We have Audubon in the practice for, I think, well over a year, nearly 2 years now. And my experience of it has been a very positive one. It has improved patient access in the sense that patients have been signposted to the most correct and appropriate service within the surgery and or outside the surgery, so community services as well. It has meant that there's less wasted appointments. Because obviously patients are aware about the cost of an appointment and how significant it is if they're missing an appointment. And of course, if the appointment's an appropriate appointment, they're less likely to miss it. I have found that obviously it creates and engenders a calm nature for the patients. Some patients don't like all music, but the majority do. And it sets up the doctor for a pleasant consultation, a calm consultation, which is more efficient and productive. I think it's a really good information system, particularly during the coronavirus outbreak. It has been very helpful, certainly while patients were coming into the surgery. And I think it is a very effective way to convey in real time information that you want to convey to your patients from, for example, NHS England. And it's a novel and effective form of communication. It's a media which people can access easily, notwithstanding those who may be deaf. And certainly reduces health inequalities because not everyone has access to the internet, and obviously paper documents can be out of date by the time you've sent them. So as Audubon is in real time changed, it can give you real time advice to patients, perhaps from NHS England, if, for example, a second wave of COVID-19 does actually occur. To be honest, I didn't even notice it. I think it was dealt with by my practice manager, and 1 minute it wasn't there, and 1 minute it was, and the next minute it was. And my practice manager advised me on the sort of the Friday it was going to be installed, and on the Monday we were up and running. I think it's obviously a painless process having it put in, and of course with a little bit of information to patients, they understand what it is, and obviously you can see within the waiting area when an announcement comes up, everyone just stops and has a listen. So it's clearly a very effective way of conveying information, important information that you want to give to patients. As regards hospitals, because obviously our agenda in a surgery is one of prevention. You can obviously change that in hospitals if that's not the main criteria of use. It may well be, again, much like our surgery, the use of appointments appropriately, trying not to miss them. But I'm sure there are many things in hospitals that you would want to convey in terms of information and knowledge and education to patients, which might be very effective use of Audubon.